Well, I'm Dr. Sai Kalyan. I'm a senior consultant neurosurgeon working in 1200-bedded multi-specialty hospital, AIG Hospitals in Gachibowli, Hyderabad, that is in Telangana, which is in South India. My areas of interest are spine. I do all simple and complex procedures in spine, including deformities and endoscopy. And I also do cerebrovascular surgery and cranial endoscopy, particularly the pituitary tumors.
Thank you for introduction. And we know that UB is progressing very rapidly. So what do you think of the future of this UB technique? Because some people, they would say that UB technique is a supplement to monopolar technique. Some people say that it is the replacement of monopolar. So what is your idea about this?
It is subjective, but however, I'm going to give my unbiased opinion about it. See, right from our residency, we have been trained with microscopes as a neurosurgeons, and we find microdiscectomy is a good technique. And the advantage of UBE is it is very similar to that of a microdiscectomy with very near vision. And the other advantage is the starting of this program needs very less investment, unlike in uniportal, which is bit expensive when compared to UBE. And this UBE, we need to understand that UBE is a endoscopic assisted surgery, whereas monoportal is a true endoscopic surgery. So for the beginners, definitely you should be acquainted with microdiscectomy before starting UBE. See, ultimately you should be knowing the open surgeries first. So knowing the anatomy of open surgery is very important. The next step would be microdiscectomy, and next would be the UBE. So you should have enough number of cases of open discectomies and microdiscectomies done before you venture into UBE. And of course, there has been a surge in taking up this UBE surgeries of late, because as I said earlier, the investment is less and people are finding it easy to do. However, they need to know the tricks and trade of this UBE surgery. For that, I would recommend all the young neurosurgeons or spine surgeons who want to venture in UBE to have a proper training before venturing into it.
Okay. Thank you for your explanation. And we know that there are many training methods in this area, and they are shining in different specific areas. So actually, the UBE technique can benefit both patients and surgeons. Okay. So next, so how do you feel about this first UBECON International Conference in Nepal? Would you like to say something to this conference, to wish its success, or to express more expectations?
Yeah, definitely. Before that, I would like to say I started as an open surgeon, followed by microsurgeries, microdiscectomies and micro lumbar surgeries. Later with some of the dry endoscopic techniques called as Destendo, and I also do uniportal. And there were some areas where which couldn't be addressed by using this uniportal and tubular, particularly the what we call we need to see the four routes, the both traversing and the both exiting routes, and that would be possible only by this UBE. That's what I feel. And 5 months back, I was here and I met Mr. Perfect. I call Dr. Nikunj as Mr. Perfect because he was a person who motivated me to take up this surgery, to do these surgeries. And I stayed here for 3 days, and he was so passionate in teaching the UBE techniques to me. And he also he made us understand what are the difficulties, challenges in this UBE surgery, what we call is the tricks and trade of this UBE surgery. And he gave me one advice: look, Dr. Sai, you need to go and start it as early as possible, or else we are going to forget it. So that is how I have started, and I have completed almost 44 cases in my this 4 months journey. And I kept sharing my work with him, and whenever I had doubts, I used to discuss the things with him, and he was readily available. And that is how he wanted me to present my work here. And after coming here, I feel very happy because getting all the UB surgeons to one platform, and it's a very well organized and a structured conference which is going on. If you see the concept, if you see the concept of this conference, it is starting from the basics to the advanced. So everything has been covered in it. So far, all the lectures which have been delivered by different speakers are very informative, and we had ample time has been given for discussion purpose, which is very important. See, what I may be knowing, you may don't know, and what you may be knowing, I may not know. So this has been an interaction platform. So I would like to congratulate Dr. Nikunj and Dr. Balgopal sir for organizing such a beautiful and wonderful conference, which is informative. And I wish I keep coming to these conferences and share our knowledge and gain some knowledge. And all the best. And you need to continue this. You need to continue this annually.
Yes.
Every year you need to have such conferences to exchange the knowledge.
Yes, of course. And it's really great to see that the UB technique can be very popular in Nepal and can be favored by many surgeons. And also such kind of conferences are very valuable chances for you to gather around to share your thoughts and exchange your ideas. It's really great. Okay, thank you. And looking forward to seeing you shining and presenting yourself and your knowledge in more and more events. Okay.
Thank you
for your time.
Thank you.
Thank you.